Kevin, why would a healthcare organization be considering a cloud modernization effort at this point?
Yeah, now is a great time. So the big tech vendors out there have brought a lot of net new services and capabilities to market over the last 3 to 5 years. A lot of things that we can really start to take advantage of from a back-end infrastructure standpoint specifically. The other side of it is some of the data centers within our health systems to date actually need a little help. Some of them have been around for a long time. Sometimes there's been some merger and acquisition activity where we have a multitude of data centers across one singular health system. So it could be a nice opportunity to look at a modernization activity and a bit of a shrinkage of the overall data center footprint.
And where do you get started? With data? With applications?
Yeah, we like to think of it holistically and consider both. Sometimes organizations will think of a cloud-based initiative or project as a singular threaded project and really focus on what is in front of them from the here and now. But what we really want to do is start to break it down. And I like to look at two very broad categories around data and start to figure out what the integration strategy could be and start to create those pathways so that we don't have siloed data across institutions. But then also look at a perspective of which, how can we implement software quickly on some of these cloud-based platforms in today's world?
And what if your data or application maturity varies across the functional units within your organization?
That's always going to be the case, I think, right? We're always going to have different levels of maturity across different domain areas or even across the multitude of different applications, and that's okay. We really want to start to create pathways to increase maturity in an iterative-based approach over the longitudinal perspective of an initiative. So it doesn't have to be get everybody from one level of maturity to another in a singular project, but how can we start to create pathways for the long term where we overall are increasing that maturity over time?
And healthcare by necessity is kind of risk averse. So what's the risk profile like for a cloud modernization effort?
Yeah, we've talked about risk as it relates to cloud, specifically within healthcare for a long time now. And frankly, some of the cloud historians will suggest that we've been in the cloud game for decades at this point. If you look outside of healthcare to retail or some of the other market areas, you'll see that they've been on cloud-based platforms for a long period of time. So there's always going to be some level of risk when you're going through a modernization approach, but we can really start to mitigate that by having a longitudinal strategy and over time start to strategically bring applications up to a different level of maturity, start to integrate from a overall data integration standpoint and really start to bring that into a cohesive methodology as we start to progress over a period of years.
Thanks, Kevin. That's great.